At the height of the Second World War, Alan Turing and other great minds worked night and day to break the Enigma code. Their goal: crack the code and help end the suffering of countless people here at home and around the world. Today's medical Alan Turings can be found in the laboratories and the universities of this country. Their mission: to get us through this pandemic and get us out of it through pioneering treatments and a safe and effective vaccine. At times, fighting a pandemic can feel like fighting a war. It's a war where humanity is all on the same side. And like in any war, it's our ingenuity that will help to turn the tide. I've been humbled by how health and technology have come together so powerfully during the pandemic. In ordinary times, some of the advances that we've made in the last 8 months could have taken 8 years. But these are extraordinary times. And it was incredible to see how the hard work of our digital dynamos during the pandemic and in the preceding years have helped us to fight for human life by keeping our health service going when it's been under pressure like never before. As we look at rising rates of hospitalization and infection, it can feel premature to talk about what has gone right. But it's imperative that we do and talk about it now, because there are important lessons that we can learn. Technology has helped us when we've needed it most. It's working now as we look to new technologies to give us mass testing and new ways of coping with the virus and its consequences. And it will help us with our recovery as we will build back better after COVID. And I firmly believe that technology will help transform healthcare for the better in the decades to come. And I just want to set out a little bit about how. First, through the effective use of data. The safe sharing of data can open up countless new opportunities. We've known that for some time now. And in this pandemic, we've really seen it. By using data properly, we've been able to find problems and tackle them in real time. Practical problems like where there's pressure on hospital beds or where we need to send vital supplies of PPE. During the pandemic, because we've been working so hard to share data properly, the resulting decisions have been faster and better, and we've been able to fix problems as we go along. But data isn't just about solving problems. It's our guiding star, helping us to chart our course and understand what steps we need to take. And we have so much more of it about the pandemic in this second peak, which means that we can take more effective decisions. For example, we made it easier to link millions of people's primary care records to the latest data on coronavirus, and this has helped us run the world's largest analysis of coronavirus risk factors. It's work that might normally have taken years, but thanks to our new framework for data processing, it went from proposal to execution in just 42 days. And when we recently launched the National COVID-19 Chest Imaging Database, which is helping us understand the virus and strengthen the pandemic response further, it is also directly improving people's lives. So, even after COVID, we will do all we can, and I will do everything in my power to keep up the momentum, to ensure we have the right environment for innovation that embraces the power of big data and machine learning and puts data at the service of some of our biggest challenges, from cancer to kidney disease, right across the board. Now, in many ways, this pandemic has been the coming of age of health tech. It was the moment when investments we made to modernize, the money, the time, the energy that's been spent, it was the moment that really reaped its reward. I'm really pleased that we'd put in place the building blocks before the pandemic, because responding would have been even harder without it. Like, for instance, the digitization of prescriptions, which means people can go online to get their repeat prescriptions. Hugely important, especially during the peak and especially for the shielding and those who are most vulnerable. Or our massive investment in broadband, which means that 99% of GP surgeries were able to offer consultations remotely at very rapid speed in a matter of a couple of weeks. Or, of course, NHS 111 evolving that into an online service, something that at the peak of the pandemic allowed 750,000 online assessments to be carried out in just one single day. And NHSX, our new unit for driving forward digital transformation, holding regular surgeries with SMEs and startups, opening the door to the sector, opening the door to innovation, so we can bring even more new healthcare technology to market, transforming everything from prevention to treatment. But all of this speaks to something else we've witnessed. It's a big change in culture forged by extraordinary times, but one that will help us in times more ordinary. We should be doing all we can to facilitate these kinds of changes, which are better for the NHS and better for patients, by making the rules around data sharing a lot simpler and giving staff on the ground the confidence to share and use data safely and ethically. An example of this was at the start of the pandemic, when we issued new guidance on information governance. We cut it down to a single page of A4 and then made it accessible to everyone who works on the front line. So it didn't have to be translated by IG experts, but so that everybody who was there to care for patients understood what was needed. The guidance said where the benefits outweigh the risks, it's okay to use any messaging service that's secure, like WhatsApp, to share information with colleagues or patients. Now, that is a really simple change. It's a safe change, and it was a game changer that showed the kind of flexibility that colleagues on the front line have been crying out for, and there's more of this to come. And I wanted to formalize how we could remove these barriers. So we've laid down the red tape challenge for information governance to make our guidance as consistent and accessible and clear and empowering as it possibly can be. Because there's no going back to the old ways of doing things. Nobody wants that. Patients like the new way of working because even in normal times it doesn't make sense for them to take a whole afternoon off work to attend a routine appointment. Colleagues like them too because they can make so much better use of their time. So I'm determined that there must be no sliding back. We must empower people to use technology for the better. And coupled with this big culture change, there's been an even bigger revolution in the health tech to be had. In some hospitals, we're already using AI to predict cancer survival rates and cut missed appointments. These emerging technologies, if developed in the right way, hold so much promise, and I want us to do so much more. Last year, we set up the National Artificial Intelligence Lab with £250 million of investment. The AI Lab, which sits within NHSX, is now speeding up the adoption of new treatments and technologies across the NHS. Technology with the potential to transform everything from how we perform brain scans to the way we diagnose heart disease. And I've seen it for myself. I've seen the clinicians using the technology to radically reduce the amount of time they need to plan cancer operations, for instance. I'm proud that we're putting ourselves in the position to be a world leader in these kinds of advances in healthcare, something that can make a real difference to the lives of staff and patients alike. It's not about replacing humans, of course it's not. It's about enhancing human decision making and giving people the tools to make the right decisions and freeing up staff, giving back the gift of time so they can focus on what they can do best. Caring, that's the bit the computers can't do. Taking care of people and, of course, saving lives. We stand at the cusp of a major revolution in health tech, a revolution underpinned by an inescapable truth that medicine through the ages has always embraced the best new technology in order to get better healthcare. And we care about the technology because we care about people. Just as Alan Turing's groundbreaking work left a powerful legacy that's shaped our modern computer age, so today's pioneering efforts can make sure we emerge stronger and healthier from this pandemic.